everyone. Thank you for joining us. This webinar on autism is presented to you by brightbot.com, where you can join the autism support group, which is totally free. And I would definitely encourage you to do that because the bigger we can make our community, the more likely that people will be able to get the help that they need. And so today's presentation will be on applied behavior analysis, otherwise known as ABA, as an intervention for those who have autism. And before I start, I would just like to note that I am not a doctor or a licensed ABA therapist. This is just my experience that I'm sharing with you. And just another thing to note, we're going to be muting everyone during the presentation, and the reason we're doing that is to eliminate outside noise. But once we're done, we'll unmute and take any questions that you might have. So we're just going to talk about an overview. So we'll talk about what ABA is, the research backing it as an intervention, what it entails, and progress that can be expected. I'll be going in depth just so that if you have a child that has autism or you know someone that does, you'll know what the intervention should include and if your child or family member is receiving the proper ABA intervention. So applied behavior analysis is based on behavior analysis, which is a scientific approach to understanding behavior and how it is affected by the environment. And what they mean by behaviors is actions and skills that people can acquire or do. And the environment is basically any influence that's physical or social that might change or be changed by the person's behavior. So behavior analysis has been used for many things. So people that want to make a lifestyle change and maybe lose weight, or people that want to learn a new language. But it was only in the 1960s that researchers found out that it could be used on those who have autism. And it basically makes sense because if you may not know, those who have autism engage in repetitive behaviors. So it kind of makes sense. As we'll talk about it, you'll see why it's a good intervention method for those with autism. So as we mentioned, behavior analysis focuses on the principles that explain how learning takes place, such as positive reinforcement. So that's a big aspect of applied behavior analysis. So it pretty much means that if a behavior is followed by an immediate reward, it's going to be more likely to occur. So ABA uses these teaching techniques and principles to increase positive behaviors and lessen the negative behaviors that we don't want to see. So ever since the 1960s, when it was first used for those with autism, there have been many techniques that have been developed since that time. And it's not only used for children. I mean, it starts from toddlers even into adulthood. And we're going to talk about the research that shows that backs it right now. So how does it benefit those with autism? So a lot of individuals with autism have deficits in communication and other things that may come normally to other people. So ABA really helps them to improve basic skills that we wouldn't even normally think about, such as making eye contact, listening, imitating. And those are just simple everyday skills, but it even goes further than that to teach them skills such as reading, talking in a conversation that can be very difficult, and basically, understanding somebody else's perspective. So what does the research say about ABA? So research on preschoolers to adults has shown that ABA techniques do improve communication, social relationships, play, self-care, school, and employment. And it also increases participation in social activities and interactions with family, which is also very important because there is that social aspect of autism where they're not really inclined to interact with others. So research has shown that it does improve that. And there have been multiple studies, and these studies are pretty intense. And by intense, I mean they'll do the therapy for 25 to 40 hours a week for 1 to 3 years just to see how effective it is. But an everyday therapy session will be repetitive, but it's not going to be as intense. So the program will allow the children to practice skills in both structured and unstructured situations, meaning that structured will be like in the classroom session or one-on-one with a therapist, but it's also, the goal is to have them use what they learn in the intervention in every day, such as at home, eating dinner with their family. And research has also shown that some preschoolers who participate in early intervention ABA for 2 or more years, they acquire like good skills to participate in regular classrooms with no additional support. And the research that's been done has shown only a small percentage of children show little improvement, but more research is needed to figure out why. And that can probably be due to the fact that not every child with autism is the same, so it's not going to work for everybody, so that does make sense. But the majority of the studies that compared intensive ABA with other interventions found that children who get intensive ABA show more improvements than those who participate in other interventions. And in addition, they find that the parents of the children that receive ABA, they experience less stress on a day-to-day basis. So, and not just for children, as we discussed, ABA is used for adults, and it actually has shown that it's effective for building life skills in teens and adults with autism. But this area of ABA, how adults benefit from it, it's not very well researched. So more research is needed on that, but it has shown so far that it works for anyone with autism. Well, not anyone, but from toddlerhood to adulthood. So now we'll talk about what the intervention involves. Now, first and foremost, as I mentioned, I'm not a qualified ABA therapist, but it's important that if you are considering ABA, that you get someone who has either is a licensed clinical psychologist with training in ABA, or there are behavior analysts who are board certified. And it's really important to check their credentials because ABA has been on the rise and it's increasing. So somebody might claim that they're an ABA therapist, but they might really not be. So you have to just make sure that before you even consider ABA therapy, that you do check the credentials. And once again, ABA it's tailored to each individual's needs. It's not like a one-size-fits-all type of intervention because, again, everyone with autism is different, so the intervention will be customized to each person's skills, needs, interests, preferences, and their family situation. So each individual program will look different, but they will have the following things in common. Now, I'm going to talk about what the planning of an ABA intervention includes and what the ongoing assessment should look like, just so you know all of the steps that should be included within the program. So once again, it should be administered by a qualified individual. And basically the treatment goals from the start are based on a very detailed assessment of the person's individual skills and preferences. And it can also include family goals that the family wants to work on in therapy and at home with the child. And the goals and instruction must be developmentally appropriate, where the child is. And they should focus on skill areas such as communication, sociability, self-care, play, and leisure, also motor development and academic skills. And basically, the goals need to emphasize skills that will allow the child to be independent and successful, not only in the short term, but the ultimate goal is for the long term. And what the intervention includes is something called discrete trial teaching, which basically you break things down into manageable steps from the simplest steps. So say that your end goal is to have the child carry a conversation. You wouldn't jump into starting a conversation with them. You would probably start with having them imitate sounds that you're producing, and then you build up gradually to carrying a conversation. And it's important that the behavior analyst takes ongoing data of the progress that the child is making, because if they're improving, then they can move on to something else, and the plan is always going to be changing, so it's not staying the same. So as they're improving, so does the plan. And just like the general ABA techniques and philosophy that you should be seeing with the instructor who's giving the therapy, so the instructor will be using a variety of the behavior analytic procedures. So like we said, there have been many new techniques, so you'll probably see different ones being incorporated. And the family members also do receive training so they can, supplement what the child is learning in the school setting at home. And they call them the learner. That's what the child receiving therapy is. So their day should be structured to provide enough opportunities for both planned and naturally occurring for them to use the ABA techniques that they're learning in therapy. And the most important thing is that the child will receive a lot of positive reinforcement for correctly doing the behaviors that you're asking of them to do. And, the emphasis is really on positive interaction and enjoyable learning. So they should be enjoying what they're doing. They shouldn't be upset by it. And one last thing that's super important is that the learner should receive no reinforcement for behaviors that pose harm or prevent learning. So if you ask them to do one thing and they don't do it correctly, you wouldn't reward them for it. And we'll talk more about what the reward system looks like. So I just discussed, the detailed planning and intervention and techniques that are used, but just like to sum everything up. So although the programs are different, they will include 3 things, and those are the discrete trial teaching, which basically means starting from the smallest task, and you build. So you have like an end goal in mind, but you break it down into smaller tasks that allow the child to learn it in steps. So, for example, usually the way the therapy goes is the therapist will give a cue, and then the child will respond, and then they get a reward for the response. So say you want the child to put a book back on the shelf after you finish reading. So you would ask them as the therapist, you would say, where does the book go? And if they say on the shelf, then you would give them a star on their token board, which we'll talk about in a minute. And also another important facet of the therapy will be teaching for generalization. So the therapy needs to be generalized so it can be used in all different environments. Not only in school, you want the child to be able to use, you want it to be able to be used at home or any other environment, not just in the school. And lastly, of course, the reinforcement. So only the behavior must be followed by the reward. So that will increase it over time, and that's how they really progress through it. And the reinforcement item usually varies by each child. So if a child has like a toy that you really know they love playing with, then that's what you'll give them when they do something correctly. And what kind of progress can you expect with ABA? So ABA does cause positive changes in the lives of those with autism in a multitude of areas, but changes don't really occur quickly. They take time. And as we said, it needs to be intense because the repetition aspect is very important of it, because that's what helps it stick over time. So, and the rate of progress is pretty much just like the goals of intervention. It varies from person to person, and it depends on their age, their level of functioning, family goals, and other factors. Each person moves at their own pace through ABA. So this is what a token board would look like, pretty much. So say the child loves to play a computer game, and here you can see that it says I'm working for, and here it's a computer, but it could be an iPad, it could be a toy, it could be anything that they enjoy playing with. So say that you're working on a sound such as ah, or like ah. Say you wanted them to say cat, bat, rat, sat. And so you tell them, you give them the cue, so you say cat. And then if they say cat, then you would give them a star. And the discrete trial teaching, as you can see, it's like different. You give them all these different trials and things to say. And when they get it correct, you give them a star. And then when you get to 5 stars, you can say, okay, now you can play on the computer for 5 minutes. But say you wanted them to say cat and they said cot, which is not the same thing. Then as per the ABA, rules, then you would not give them the star because they didn't produce it correctly. Because then in their mind, they would say, oh, if I said, caught, I still get a star. It's not as effective. It kind of defeats the whole purpose. And again, with ABA, it's just like super important that once they get it right, the trial that you're asking them to do, you immediately give them the star. And then once you have, like, you filled the board, then you would immediately let them go on the computer. And it's that you have to immediately reward them once they get it right. Otherwise, it's not going to stick, because they associate their award with getting something correct with their award. So that's why it'll be more likely to occur. So just to, sum everything up again, like a quick recap. So ABA uses learning techniques and principles to increase positive behavior and lessen ones that get in the way of learning. And they can improve communication, social relationships, foster basic skills such as looking, listening, imitating, as well as complex skills such as reading. And once again, the specific intervention goals and strategies will differ for each individual person's plan, but they will include discrete trial training, generalization, and reinforcement. And once again, it's super important that the intervention is administered by a certified professional. And lastly, the progress depends on many factors such as age, level of functioning, family goals, and other factors. So you're not going to see the same progress across like every single child that gets ABA. Everyone moves at their different pace because autism is a spectrum disorder. So you can't really expect the same progress with one child and another one as well. So just keep these things in mind if ABA is something that you're considering. And as a parent, or if you have like a family member that does have a child with autism, it's just like super important to be involved and attend the IEP meetings and know exactly what kind of therapy your child is getting. It's important to be informed and know the services that your child is receiving. So yeah, that sums everything up, and we'll be taking questions now.
One second.
Nadine.
Hi.
Hi. I guess it would seem that ABA could be utilized in, I said, different types of disorders, right?
Yes, of course, yeah. It's used with children with autism, but it's also, they started using it for children with autism, but they use it across other disabilities, as I found when I was doing some research.
Okay.
And is it, Nadine, is it sort of like a reward program, like, or activity?
Yes, absolutely. That's exactly what it is. They get a reward for doing the correct behavior. It's definitely a reward system. Yep, that's the whole premise of ABA, that if they do a correct behavior and it's associated with a reward, the behavior is more likely to increase over time.
Okay. So it would make sense then to have the whole family involved.
Yes, of course. Yeah. Like I said, a comprehensive plan should involve the family members. And if it doesn't, then it's not really comprehensive because the child won't be able to carry over what they're using in school if it's not being continually reinforced. So if they're not practicing it at home, and then say the therapist meets with the child twice a week, she'll come next week and then she'll notice that, it's not being carried over, and it actually will, impede the progress.
In the example of the token board, can you identify where the intervention actually is, and where the analysis is?
What do you mean by that?
Well, you kept on saying that there was intervention that had to take place, and I assume the teacher would intervene, or the parent or whomever would intervene and to change the child's behavior. So I understand the intervention in theory, but what you were describing in the token board just seemed like a typical way to teach kids. And I wasn't sure, is there something that precedes that? Is there would you say there's a long record of the kid mispronouncing the word, for instance, and then the teacher intervenes? Is that where the intervention takes place?
Yeah, okay. So first of all, that was just one example I was giving, but the therapist can work on different things. It really depends on the assessment and what the deficits the child is showing. But say like the teacher wanted to ask the child to say something. It starts here's how it goes. A cue is given by the person, and then the child gives a response, and then there's the reward. So the cue is you ask them oh, where does this go? Or what? It doesn't even have to be school related, It could just be oh, where do you put your shoes? And then he'll say, oh, this is where I put my shoes. And then you're you give a response would be their word, and you say great job, or you give them a thumbs up. That's basically what the intervention is. But it just differs from child to child.
And so is there analysis per se?
Well, yeah, that is, the therapist giving, the ABA does analyze, initially, it's in the assessment, what their deficits are. And then as they go on, yeah, you are analyzing. So they're taking trials, and I see them doing, when I was observing therapists, they would take note of, you do collect data. It is a lot of analyzing the data that you're taking from each session. So you'll say, oh, Johnny got 7 out of 10 of the trials I was asking him right. And then next week it went up to 8 trials, and then 9, and then 10. And then at that point you can move on to your next goal. So that's where it's like a continual, like, taking data and analyzing like what they're progressing towards and what the next goal is that will be worked on after that.
Thank you.
Hey, Nadine, could this be done like in a collective environment? What I mean by that is number of kids, say like in a classroom.
Mm-hmm. Yeah.
Oh, okay.
Yeah, I've seen it too. Like, they'll have like a puzzle or something that they're working on, and then like they'll pass it around, and they'll have each child work on it, or be like, or they'll be like, pick up, like, put the blue in, like, to complete the puzzle, and then they'll do it, and then they'll reward each child like as they go around the circle, and so that also helps with like social interaction, and say like they're just working on their colors or something. So yeah, it is done in group sessions as well.
Oh, okay.
Nadine, I have a niece whose son is autistic, and she said she took him to the therapist the other day, the speech therapist, and she gave him a toy apple. They're not in this country; they're in Trinidad.
Okay.
And he associates an apple with a stem and a leaf. And he was on YouTube, and he saw something that looks like an apple, but it did not have a stem or a leaf. And they gave it a different name. So when she gave him this apple, this toy apple, it had neither stem nor leaf.
Mm-hmm.
So he associated it with what he saw on the YouTube video. So she in turn told the mother that he's not responding, he's speaking gibberish. So she in turn, what she did, she had to pull up the YouTube video to show the therapist, I guess the two, what she's doing is clashing the two.
Mm-hmm. Yeah, that can be conflicting because you'll have a picture of something, and I guess like usually they'll give children with autism like pictures or objects because they're better at seeing like things visually. But then like the downside of that is not everything is going to look like that one object, so I can see how it can be confusing. So that's probably, the child probably just got confused between the two.
Okay.
Yeah, because not everything looks the same.
Thank you.
No problem.
Nadine?
Yeah.
Okay, let's say a child is receiving the therapy in school, and you said that it's so that the family should participate. What if they're not able to, like during the session, like for instance, what to teach them how to get the child to say something and say correctly and give them the rewards and do those things, and they're not able to attend? How do the parents get the necessary information to, would they have to send it to them, or if they're just not able to participate in the session? How does that work?
Well, usually like if the child is in school, they're receiving therapy at school. So at that point, the parents aren't really required to be in the session. But then maybe if they are receiving it outside, then the parent will be the one taking them to the session. So you'd be there, but you're not really, as a parent, you're not required to be there. But I guess before they start giving the ABA therapy, they talk the parents through it and just give them an overview of what it entails and how they should be carrying them over at home. So, I mean, if you can't attend the session, this doesn't mean that you're not going to be able to, carry over the therapy that they're doing, because they'll explain it to you like before they start the therapy. So you don't have to be there every time afterwards. But the parents should be making the effort to at least, the therapist will be checking in with the parents like every now and then just to update you on the progress of the child. So that should be possible to be done, but you don't have to be there at every single session.
Okay. Thanks.
No problem. Any other questions?
Nadine, if they can't be there for all the sessions, they should probably be there for the initial one.
Yes, of course.
Because then typically if they're home on the weekend, they need to be able to do that with the child or even after hours.
Yes, of course. That's why I said like it's important to go to like every IEP meeting they have and like any initial meetings, and to just even don't wait for the therapist to contact you. You know, if you want to know how your child is doing, then you should contact them. Like, be very active in their life, because that's super important. Like, the more knowledgeable and aware you are, the better off they'll be, and the better off, like, the easier it'll be for you to carry over the techniques like in everyday life, and they'll benefit from that a lot more.
Does any kind of negative reinforcement come to play in that? I mean,
well, yeah, the negative reinforcement is not like encouraged, because that would, you know, increase the behaviors that you don't want to see. So that's not a part of like ABA. The goal is to like only reinforce positive behavior, not like negative behavior. Because if you're reinforcing the two, then the child will definitely get confused, and they're not going to be able to differentiate between positive and negative. So you just want to like try to your best to only reinforce the positive behavior, not the negative one. Do you guys have any other questions about anything? All right, well, thank you so much for joining us, and thank you so much for all of your questions. I had a great time. I hope to see you guys soon.
thank you, Nadine.
Thank you.
Good night.